Dr. Jeremy Steinberger is Assistant Professor of Neurosurgery and Orthopedics at the Icahn School of Medicine and serves as Director of Minimally Invasive Spine Surgery for the Department of Neurosurgery in the Mount Sinai Health System. Jeremy received his bachelor's degree from Yeshiva University, where he studied biology, and his medical degree from Albert Einstein School of Medicine. Dr. Steinberger is a graduate of the Mount Sinai Neurosurgery Residency Program, class of 2018. He completed a one-year fellowship in spine at the Hospital for Special Surgery, focusing on minimally invasive surgical techniques, prior to joining our faculty. Dr. Steinberger's wife is a radiologist at Mount Sinai, and they have 3 kids, all under the age of 6.
What is your usual role within Mount Sinai? What have you been assigned to do during the COVID-19 crisis?
My day-to-day, the patients I see, the cases I do are all focused on spine, specifically minimally invasive. And then when this all happened, basically I canceled all of my elective spine cases. I've done 1 spine surgery in the past month, and that was for someone who had urinary incontinence, and we had to do it urgently. But other than that, I've done zero spine cases. And then as of last week, they put me in the intensive care unit with COVID patients, and we're basically exploring our role and seeing how we could be most helpful. And it's definitely a day-by-day evolution.
Can you describe what your new day-to-day life is like? How many days and hours are you working each week?
Yeah, so basically it's about 3 12-hour shifts a week. Some weeks 5, some weeks 2, and then it all kind of balances out over time. Like I said, it's changing kind of every day. And then, they need us in different hospitals: Mount Sinai West, Mount Sinai Morningside, Mount Sinai Hospital. So we're trying to fill a lot of voids as best we can. There's definitely like a risk benefit in every single thing we do. So I have a patient who needs their routine post-operative x-rays, and I said, obviously, I think you should wait till this blows over just to come into a hospital. But then there were days where I was traveling in the beginning of when this was just, starting to pick up steam. There was a day where I went west to Luke's. And I decided, because I wanted to see all my patients, but I decided that's just not, it's not the best thing right now. So we have to, but it's strange. So I like to see my patients every single day. But now, it's alternating days or something like that. Anything to kind of be taking germs from one hospital to another.
What sort of new skills have you had to acquire to do your new responsibilities? How did you prepare?
Good question. So it really does feel like a war right now. So I think there is not a lot of time to mentally prepare or fully prepare in some ways. I think I'm definitely in a zone that's not my comfort zone for sure. On the other hand, residency was 7 years, and during those 7 years, you spent a lot of time in intensive care units, and then medical school was 4 years for a reason, so you can really kind of understand a lot of the physiology and pathophysiology of all disease processes. And there were times in med school where I was thinking, why do I need to know this? And now I think the answer has come in the form of coronavirus. But the other thing is, as a surgeon, we're in the operating room every day, and that means we're dealing with anesthesiologists and intubating patients. We're dealing with patients hooked up to monitors. And we're dealing with patients who often are sick or who have complex procedures, so you need to put in lines like arterial lines or central lines. So there has been a lot of exposure over the years that kind of, when you need to step up, things come back to you that you may not have even known that you knew how to do these things. I think it took me probably 3 full days to kind of at least get the basic understanding of how these patients function and how to wean them off the ventilator and how to, deal with their fluids and their hydration and their, the whole idea of proning a patient. was a totally new concept for me. So there's definitely new things. The only silver lining is that a lot of these patients behave the same way. So once you figure out their pattern of how their lungs are working and how they need to be functioning on a ventilator and how you need to support them with a ventilator and how you need to wean them off is a very similar pattern, which is a good thing. It's 100% an evolution day by day. I think that for me specifically, I'm in the ICU, so I'm dealing with the intensivists who are really the captains of the ship, and they've been really stepping up and being outstanding. And then we're kind of filling in whatever voids there are and whatever adjuncts and supportive roles we can play. But I think, depending on where you are, the emergency room obviously is crazy. The anesthesiologists are running all over the hospital, but in the intensive care unit, it's really the intensivists who are running the show. And we have a lot of neurointensivists who have really stepped up and are kind of in leadership roles right now. And we're trying to help them in any way.
What's it like in your unit now? Can you describe the environment? What's the feeling among staff? What are the protocols you need to follow that are new? Describe what you've been seeing.
Well, we're constantly wearing PPE from the second we walk into the unit to the instant we leave. So we are full time in face shield, mask, gloves, gowns, hairnets, and shoe covers. So we're covered head to toe because we are in a unit where there are a lot of patients on breathing tubes, and everybody in the unit is COVID positive. So we know we're in the heart of it, in the meat of it. And in a way that makes in some ways it's a very safe place to be, because everybody has it, everybody's in negative pressure room, and you're covered head to toe. So it's kind of a weird way to think about it, but I feel very safe in the ICU actually, because it's known and no one lets their guard down. So there's no question that people are under pressure and people are dealing with double their patient load, if not more, than they're accustomed to. What I've noticed is that everyone has really stepped up. There's a camaraderie and a common understanding. My wife is also in the hospital, and she was saying that she's never seen people be so nice to each other in her entire career. I think because people understand the gravity, and it's kind of like a war right now, and people are just coming together and filling their roles. Without being cheesy, the nurses are absolutely heroes. The intensive care, the respiratory therapists, the custodians. It's like it's a really dangerous place to be, and everyone has just come together and kind of really risen up to the challenge.
How has your role in the Department of Neurosurgery prepared you for this new responsibility?
I think neurosurgery prepared me extremely well for this. I think obviously, of course, there are areas I'm not a specialist in and that I'm not comfortable in, but I think dealing with crises and dealing with crashing patients and dealing with very sick patients, that's something that we did have a lot of exposure to in residency. I think also that we've dealt with a lot of patients with, ruptured aneurysms or strokes or paralysis from spinal cord compression. And so you also I think one void that I feel I've been able to fill is speaking with patients and comforting them and reassuring them, but also explaining to them what's going on and the gravity of it. So dealing with patients who are in extremis and their families who are obviously very worried, especially now because the patients can't even visit their sick family members. And that's obviously an extremely unique and challenging problem we're facing.
The coronavirus is scary. Everyone has a certain level of fear about what might happen to them if they get sick. How are you feeling? How have these feelings influenced your work?
For me personally, my biggest fear, which a lot of other people have also, is just coming home at the end of the day. So I haven't quite figured out my routine, but basically I have 3 young kids at home under 6. So it's hard to make the decision of whether or not I should come home. And then once I made the decision to just make sure I'm not giving it to anybody else. So I mean, my routine is I take everything off in the hallway and then I jump right in the shower and I don't let anybody, but each their own. But that's, for me, the most anxiety provoking part of this is the fact that I have kids at home. And that my wife is also going into the hospital. And so she's also getting subjected to different area of the hospital. So we're definitely not in the safest places in the hospital. And we're definitely going in every day or almost every day. So that's the most challenging part for me. On the other hand, on the reverse of it, if I were 60, I'd be nervous about my own health more than I am now. So, because obviously young people could get sick too, but I think, there's obvious data that the older you get, the more likely it is you'll have a major issue with coronavirus. So I think that working in my favor of alleviating my anxiety is my age. Not to say I'm invincible or not susceptible, but of course the young kids at home makes me very nervous.
Are you doing anything outside of work to help you power through this? How about sleep, exercise, reading, meditation, cooking, touching base with your family and friends? What are you doing at home to help you make it through the day?
Yeah, FaceTiming with family. Luckily, 20 years ago, we probably wouldn't have the means to be able to see our family. And I have a 95-year-old grandfather who we're talking to 3 times a week instead of once every 3 weeks like we used to do. So it's, in some ways it's really nice that we do have tools that we're alone, but not alone.
What would you like other people to know about what you are experiencing and what we are experiencing taking care of this crisis?
I've been amazed at how everybody's come together. I think my personal challenge is finding a role for me to be most helpful. We're very subspecialized in neurosurgery, and I'm trying to bring whatever skill set I have to the ICU and to, patients who are trying to avoid being intubated to try to get them extubated. And that's been my challenge. But I think everyone always says that New Yorkers come together in times of crisis. And I've been astounded by the way people have been working together in the hospital and been kind to each other and been supportive.
Do you think your life will change in long-term ways because of this crisis? How do you think healthcare is going to change?
I think that we have to be prepared for this to come back next year. And I think that's going to be the biggest focus going forward once this hopefully resolves soon, is to figure out how to prevent it from getting to this point next time something like this comes around. I think it's amazing we have these incredible scientific developments and surgical developments, and we're so many brilliant scientists, but all it takes is one virus and it just shuts down a city and it shuts down an economy, and it makes us realize how susceptible we are and how we have so much more to learn.
When the worst part of this crisis is over, what's one of the first things you want to do?
So many things. I think getting a drink with some of my colleagues who I've been working with in ICU is going to be the first thing that I do when we're allowed to go to bars again, and the first round's on me.